Good morning, good afternoon, good evening, everyone. Thank you for attending this session on Insight from Global Health Supply Chain Initiative in Africa, focusing on our second year of implementation. This session will be presented by Judith, our Associate Director of ASCM Global Health Supply Chain Initiative in Kenya, and myself, Clement Ngombo, Associate Director of Global Health Supply Chain Initiative in Senegal. Supply Chain Management, ASCM, is the global leader in supply chain organizational transformation, innovation, and leadership. As the largest nonprofit association for supply chain, we are a non-based partner connecting companies around the world to the newest thoughts on leadership on all aspects of supply chain. We have over 46,000 individual members, 73 corporate members in over 100 countries. ASCM is built on the foundation of 60 years of EPIC's history and experience. At ASCM, our passion is driving innovation in the industry with new products, services, and partnerships that enable companies to more optimize their supply chains, secure their competitive advantage, and positively impact their bottom lines. I will give you a brief introduction on our pillar, starting with learning and development. ASCM is continuing to provide the industry-leading EPIC certifications and trainings. For more than 60 years, EPIC certifications and the body of knowledge have been a global standard in learning and professional development. We have demonstrated a commitment to global supply chain excellence and are proud to offer the globally recognized EPIC certification programs, which companies around the world have come to trust and as well as take into consideration when recruiting and making hiring decisions. Our next pillar is corporate transformation pillar. As the global leader in supply chain organizational transformations, innovation, and leadership, we are your unbased partner, providing corporations with access to industry experts, framework, and global standard to help transformation your supply chain. ASCM can help build your roadmap to supply chain excellence. We give your team the development tools they need to become effective supply chain leaders and provide global standards and expertise to help organizations stay competitive. Our last pillar is making an impact. We believe supply chain is bigger than boxes stacked in a warehouse or containers crossing an ocean. Supply chains impact communities across the globe. And as an industry authority, ASCM is dedicated to helping businesses create ethical, efficient, economical supply chains so that impact is a positive one. Through the ASCM Foundation, we are taking ambitious and actions to create a better world through supply chain by launching and expanding initiatives that draw on supply chains to address global challenges. Now, let's see a snapshot of how supply chains are transforming the world and how ASCM is empowering individuals and communities. You're welcome to the snapshot.
Every day, every instant, there is a symphony being played on the grandest scale. A feat of precision and coordination, unparalleled in human history, connecting billions of lives and empowering communities to find their purpose and their passion. In private, in public, at home, and at work, Supply chains are transforming the world. As the world becomes more connected and more competitive, companies are striving for more than efficiency. And ASCM is helping supply chain professionals rise to the challenge.
When we improve supply chains, we uplift the world. Better supply chains empower communities and individuals. It's a chain reaction. There is poor access to medicines in these countries. Most of the issues are linked to insufficient supply chains. By leveraging on ASCM's proven best practices and global network, we aim to improve supply chains in Africa and in turn ultimately improve the lives of our people. Communities like these finally thrive.
It's a seismic shift. Commerce, infrastructure, and communities are lifted up by rising standards in the global supply chain. The most pressing ethical issues are finally being addressed. Corruption, poor working conditions, environmental issues, workplace discrimination, and unethical sourcing. ASCM is helping to transform countries, corporations, and communities. It all starts with the people. And the impact begins with you, the first link in the chain. A better world through supply chain.
Thank you very much for watching this snapshot. Now we are going to talk more about ASCM Foundation, ASCM investment in Africa. The ASCM Foundation Global Health Supply Chain Initiative in Africa is a long-term strategy that synchronizes all current and future donor investment in the targeted countries. Current investment include the Bill and Melinda Gates Foundation grant, a technical support services agreement with the Global Fund, and an ongoing relationship with the United Nations. I know my colleague Judith will come with more details on key outcomes and interventions related to all the current investments. Now let's talk about ASCM team. Our team consists of individuals from various backgrounds, skills, and knowledge. We believe in our strength being in our diversity. Our Global Health Supply Chain Initiative team on the ground in Senegal, Nigeria, Kenya, and South Africa are providing supply chain technical support for Ministries of Health and related government-owned public health agencies. As a team, we are not only helping to build a visible, self-reliant supply chain talent capability in Africa that utilize ASCM tools to improve their continent supply chain, but we are also making an impact on the lives of the communities we come from. Now, Judith, I will turn this over to you.
Thank you so much, Clement. I am honored to take you through the key interventions that we are focused on. What are some of the results we have seen, as well as lessons we have learned in the course of implementing this Global Health Supply Chain Initiative. In the last 2 years, the GHSC has focused on achieving outcomes in the following areas. First, increasing institutional knowledge as it relates to supply chains in these markets, enabling ASCM to be an effective association by the end of 2020. The GHSC team worked towards building sustainable supply chain communities, scaling the use of impact of the GHSC maturity model and associated community-driven best practices, and introduced globally recognized and locally adapted methods. We will see this some more during the presentation. Secondly, growth in supply chain communities locally, regionally, and globally, leveraging the ASCM membership and event engagement platforms. Thirdly, increase the utilization of the global health supply chain maturity model while leveraging both facilitated and self-guided approaches, connecting with other models, and alignment with the Ministries of Health 5-year supply chain strategies. Fourthly, building strategic capabilities within the Ministries of Health staff through formal training and certification, transformational learning, leveraging global standards, and program-specific mentoring and knowledge transfer. And lastly, with COVID-19, the GHSC team has leveraged on opportunities to support the MOH on COVID-19 preparedness, response, and recovery. We see these interventions in the long run leading to an overall increase in the number of lives saved due to better preparedness, response, and recovery in global health supply chains. Now I shall proceed to take a deep dive into some key insights aligned to the interventions mentioned above. The GHSC initiative in Africa has worked to build sustainable supply chain communities through enhancing capability of an institution to set and achieve supply chain goals, through impacting knowledge systems at both individual and institutional level. This has been done with sustainability in mind. The photos in this slide depict workshops aimed at strengthening institutional knowledge of the GHSC initiative in different geographies. From left to right in an anti-clockwise direction, the first photo shows a workshop drawing stakeholders and the GHSC team from all 4 countries, that is South Africa, Nigeria, Senegal, and Kenya, with the workshop being conducted in both English and French. The second, third, and fourth photo show in-country trainings drawing collaboration and participation of key in-country supply chain stakeholders, including the Ministry of Health. Forums like this have provided a good foundation for teams in the different institutions to work together and tap into supply chain resources of the different stakeholders. Our second area is the growth of supply chain communities. Growing supply chain communities has been enhanced by providing opportunities for private, public, and academia to engage in structured forums that combine technical workshops as well as leadership forums. All 3 countries hosted leadership forums that brought together like-minded supply chain practitioners from private sector, public sector, the academia, and not-for-profit to exchange not only ideas, encourage dialogue, shape opinions, collaborate, and create practical solutions on key supply chain issues facing the public health sector. The program across all the leadership forums in the 3 countries included presentations from industry peers and case studies from leading organizations. For example, in Kenya, the focus was on digital transformation in supply chain and how emerging technologies are disrupting supply chains. Participants agreed that supply chain management will be confronted with tremendous change in the coming years due to impact and change in technology. I would like to share what we call the voice of the customer feedback from these leadership forums from 3 key stakeholders. From the donors, there was a recommendation, and I quote verbatim, "We need more coordination among partners to avoid duplication and parallel tools." From the private sector, MOH or Ministry of Health should explore the opportunity of partnership with private sector. Then the voice of the public sector chimed in with, "Let's involve more people from downstream supply chain in all initiatives going around, be it training or assessments. That's how we will make impact." So a key ingredient of success for this growth has been community engagement, that is ensuring there is a deliberate effort made that encourages infusion of public and private sector practices. The GHSC initiative has made efforts to close the gap between academia and supply chain profession. For instance, in Senegal, there has been engagement of MBA students in leadership forums. This has served to expose the students to industry experts, networking opportunities, as well as learning industry best practices that they apply as they get back to work. Again, in Senegal, we have provided 72 supply chain excellence books to African Management Institute. This was in the spirit of supporting young talent development in Africa. Incorporating maturity model and SCORE-P into academic and professional educational programs to build both awareness and technical capability. And as a result, we have seen 20 MBA students trained in Global Health Supply Chain Maturity Model and SCORE-P. This knowledge and support has traversed beyond borders, from Senegal to neighboring Francophone countries. This shows the demand that has been created for supply chain technical support from the GHSC team. A key strategy that has promoted growth of supply chain communities in the three target markets is strategic and continuous engagement with key stakeholders, implementing partners like the Ministry of Health, ARC, Chemonics, UNFPA, InSupply, Kaizen, and World Food Programme. Some of the factors that increase stakeholders' engagement and successful delivery include working shoulder to shoulder with the Ministry of Health and making sure that they take the driver's seat, having all initiatives and actions shared widely amongst implementing partners, and going beyond donors or organizational boundaries by leveraging the maturity model to also educational institutions. Despite the setback presented by COVID-19, ASCM continued to provide opportunities to grow supply chain communities in Africa and beyond by holding a virtual conference in September 2020. This brought together corporate, public, and private supply chain professionals to advance supply chain discourses. As we now know, in this year, efficient and effective supply chain management in the public health space has never been more important than it is right now. It therefore became paramount to extend the ASCM corporate membership to Ministries of Health. The corporate members have been able to access tools and resources around the industry's foremost research to help them reach new levels of success. Drawn from this corporate membership effort, MOH staff were able to participate in the ASCM Virtual Conference 2020. The GHSC initiative has focused its effort in this third intervention area. First, in reviewing the initial version of the maturity model and developing a user-friendly digital version and its supporting training materials in both English and French. To accompany this key resource, it was deemed important to develop and operationalize a GHSC microsite, which is a one-stop shop that can be used for assessment and training support of facilitators and supply chain teams. All materials here are made freely available to such supply chain professionals and institutions. To enhance the utility of the maturity model, following an assessment, you can visualize supply chain data using digital real-time platform hosted by Appmetrics. To learn more about the GHSC maturity model and its utility, the GHSC team is running a workshop at 11:15 GMT time, led by Bolu Awesu and Lerato Thabede. We encourage you to participate in this session. COVID-19 pandemic came with opportunities to think out of the box for delivery of facilitator trainings and supply chain assessments. So because of restrictions in physical meetings and gatherings, what did we do? The maturity model version 8 facilitator trainings were initially conducted virtually. Then we followed a blended approach of physical and virtual with adherence to COVID-19 guidelines. Similarly, supply chain assessments using the maturity model of county and country public health supply chains have been conducted using this same blended approach. And the microsite has been a key resource since it is a one-stop shop. Results from this area of intervention have been positive, with a total of 235 trained in 6 workshops across Nigeria, Kenya, and Senegal, and including other Francophone countries that have benefited, and these are Burkina Faso and Togo. Some of the improvement projects that have come out of these assessments include developing a demand plan for family planning commodities. 2, improving service delivery point or health facility visibility. And scheduling continuous professional development sessions to improve store inventory management skills of supply chain staff working in the counties or regions. These are examples of improvement projects that have been realized from the supply chain assessments that have been conducted this year. For this presentation, we have deliberately pulled out results that focus on 3 countries of BMGF focus. However, the results span beyond the continent. The total assessments done so far comes to 228, and out of these, 96 have been done in the 3 target markets, that's Senegal, Kenya, and Nigeria. And this captures assessments done as the tool evolved from version 6 to 8. Version 8 was launched early this year, and so far from this has translated to 12 assessments. During the assessments, the GHSC team provided technical support to ensure quality and also support to ensure the right team was picked to provide rich knowledge of the supply chain being assessed. As at the time of this conference presentation, an overall assessment score of 50.7 has been achieved, and we are optimistic with implementation of the improvement projects that came out of the assessments, as well as follow-on reassessments. We shall see an improved overall score in the year 2021. Of the aggregate supply chains ever assessed using the GHSC maturity model, family planning takes the lead, followed by essential medicines and reproductive health. We can see that there is a need for utilization of the tool, and with COVID-19, this has potential to draw greater utilization. What we have also seen is there is a direct correlation or relationship between maturity and supply chain performance. As the supply chain matures, the performance of the supply chain improves, and this is exhibited by improved product availability. The Global Fund engaged ASCM to provide a technical services plan to support supply chain organizational strengthening strategy in Nigeria. This photo depicts what happened in Nigeria. Running between November 2019 and May 2021, ASCM solution focuses on building the capability of leaders, professionals, and the public health workforce, leveraging proven programs from ASCM's corporate transformation, learning, and development pillars. This transformation and learning program adopts a structured methodology using supply chain operations reference, that's core model, that is designed to develop supply chain strategic clarity, alignment, and excellence. Let's talk about some of the changes we have seen here. So as part of the improvement ideas, the team proposed the development of a long-term master plan for human resources, particularly at the local and state government levels, as well as a capacity building plan for supply chain staff, where these staff are trained by supply chain functional area, with plans to leverage on online training programs. The online training programs have actually started as part of the organizational capability plan phase. It would be important to also just mention some of the key improvements that I've seen as the program has progressed. Number one, we've seen improvement in the coordination and collaboration role played by the PSM unit. A detailed look at the malaria supply chain during the TLP showcased the multiple players involved in the supply chain and the need for more collaboration to improve the supply chain performance. Secondly, the team acknowledged a gap in the most recently adopted standard operating procedures, which was done in October 2019, and has planned to incorporate some action items from the TLP in the next SOP development. Those are some of the improvement projects. So in the long run, we see these programs leading to globally recognized certifications and endorsement in supply chain, such as CPIM, that's Certified in Production and Inventory Management, and SCOPI, that is Supply Chain Operations Reference Professional. The overall success of the program is being monitored by the Project Management Office, that's PMO, which evaluates the impact of the training to ensure they are delivering on the stated objectives. Building strategic capabilities with Ministries of Health has been one of our core intervention areas. A good example is policy development. So what has our role been? Number one, we've supported the Kenyan Ministry of Health on development of the Health Products and Technologies Supply Chain Strategic Plan 2020-2025. And this is scheduled to be launched in November 2020. We've also supported the Nigerian Ministry of Health on Supply Chain Strategic Plan. A key area under building strategic capabilities is training select Nigerian Ministry of Health officials on SCORE and its application to improve supply chain performance. During this COVID-19 period, we shared principles of demand causes with Ministry of Health staff and stakeholders in Kenya, Senegal, South Africa, and Nigeria. An example of the course that was offered during this time was Basics of Distribution and Logistics, which introduces the fundamental concepts required to create an optimal distribution and logistics strategy. You get to learn why distribution channels are so important. You are able to describe different channel design models, to explain trade-offs between different channel network designs, including customer response time, product variety, product availability, customer response time, product and delivery time. You're also able to explore inventory management and its function in distribution and logistics. More than 200 supply chain health professionals across these 3 countries have subscribed to this online course. Preparedness, response, and recovery during the COVID-19 period has seen the GHSC team actively involved in country COVID-19 activities, providing technical support. So from providing input in the resource mobilization working group and supporting quantification of lab testing kits and consumables, to in Senegal, the in-country COVID-19 task force engaged in the ASCM COVID-19 virtual community, and we were able to provide support to preparedness meetings for countrywide mass testing plans, as well as technical support provided to the COVID-19 task force logistics subgroup in Senegal. And finally, conducting COVID-19 risk assessment using the GHSC maturity model. And this gave us valuable insight as to how the maturity of the COVID-19 supply chain looked like and which were the weak areas that needed action. If you're to ask what next, this is what I would tell you. So when we connect the same time next year, our story will be, we have built visible, reliant, self-reliant supply chain talent capability in Africa that utilizes global health supply chain tools to improve country and regional supply chains in the different geographies, as well as make an impact on the lives of our communities where we live. A better world through supply chain, that's our passion. Quoting our CEO, Eb Eshkenazi's words, at ASCM, we believe there is unlimited potential for supply chains to shape the world in which we live. By mobilizing the supply chain community, we can create opportunity and solve critical problems affecting countless lives. Thank you very much for listening.
Thank you very much, Judith, for this brilliant presentation. Now it's time to turn to the question and answer and to collect also some comments from the participant. Thank you very much.